आज ही ओलाडॉक ऐप डाउनलोड करें। ओलाडॉक, डॉक्टर का अपॉइंटमेंट आसानी से।
Assalamu alaikum. My name is Dr. Muhammad Usama Maood. Currently, I'm working as a general dentist at TreatMe Medical and Dental Center, Satellite Town, Rawalpindi. The topic I chose today has affected million in worldwide, which is dental caries, and it is commonly known as the tooth decay or the cavities. I would like to talk about the basic concept and the basic structure of the tooth or the human tooth anatomy. The human tooth consists of three major components or three parts. The first layer is called the enamel, which is the most protective layer and the hard layer of your tooth. The second layer is a little bit darker and the sensitive part of your tooth, which is the dentine. And the last and the core of the tooth and the most important part of your tooth is the pulp, which is the vital part of your tooth. Now let's talk about how dental caries develops. It is a misconception that dental caries is only developed by the bacteria. The four major components that will cause to the dental caries are: the first, the most important part is your tooth, obviously. Number second is the bacteria. Number third is the time. Number fourth is your overall hygiene. If your hygiene is not good enough and your brushing is not adequate, then it will lead to the provide bacteria the enough time to eat on the food that is present on your tooth and damage your tooth structure. Who can develop the dental caries? While anyone can develop the dental caries, but there are few factors that accelerate this process. The most important in the first part is your overall hygiene. Second is the inadequate brushing and exposure to less fluoride toothpaste. The third is the dry mouth, and also the frequent use of starchy, sugary and acidic food and drinks, carbonated drinks. How can you prevent dental caries? As the old saying goes, that prevention is always better than the cure. You can prevent dental caries by maintaining your good hygiene, brushing twice a day, and the important thing is that you have to brush your teeth for 2 minutes at least, because it is the time that is required by your tooth to absorb the fluoride. Number third is to limit your sugary, starchy and acidic food and carbonated drinks, and also visit your dentist on regular basis to catch dental caries on the earlier stage. Keep yourself hydrated to maintain good health of your saliva, because your saliva neutralizes the acid that is produced by the bacteria on your tooth. And last but not the least, it is very important to add flossing in your daily life routine. What if you already have cavities? If you have cavity, go to the dentist. He will check if the cavity has affected the first and the second layer, the enamel and the dentine, then it is cured by the procedure known as the dental filling. But if the bacteria has involved the pulp or the vital part or the third layer of your tooth, then the treatment would be RCT. The full form of the RCT is root canal treatment. It is the process in which we remove the pulp of the tooth and fill it with the biocompatible material. In that case, your tooth becomes dead, but it will provide all the function it is supposed to. If your dentist has treated you with the RCT, always follow that treatment with the crown. Because it will prevent the breakage of your teeth, because now your tooth has become non-vital. Its pulp had been removed. Now it has become more brittle to the forces you apply while eating and mastication. So you have to apply a crown over it to prevent the breakage of your tooth. Thank you for watching, and don't forget to prioritize your oral health, because it's the gateway to your overall well-being. Stay healthy, stay smiling.
पाकिस्तान के टॉप डॉक्टर्स के साथ अपॉइंटमेंट बुक करें, वो भी पेशेंट फीडबैक देखते हुए। आज ही ओलाडॉक ऐप डाउनलोड करें। ओलाडॉक, डॉक्टर का अपॉइंटमेंट आसानी से।